ChatGPT replace therapists? No. Can therapists use ChatGPT effectively? A big yes. If therapists are using it efficiently, ethically, and responsibly, ChatGPT can do wonders. Hi everyone, I'm Dr. Aanchal Makhija, founder of Therapy Trailblazer Academy, where I help psychology students become confident, ethical, and client-ready therapists. Artificial intelligence is transforming healthcare for sure, but is it transforming psychologists? It is helping psychologists. Yes, it is. Today only I was seeing an ad where the Claude was promoting it to psychologists that how Claude can be used as a friend, as an AI expert for psychologists. So it is going to help in many ways. But today I'm sharing 4 rules with you. I will be sharing 3 practical tools, and I will also be sharing where you should not use AI as a psychologist, budding psychologist, or therapist. So, in my previous video of AI and therapist, I've already shared in which all things you can use ChatGPT, psychoeducation worksheet. You can go ahead and watch my previous video. But let me tell you 4 quick rules or ethical guidelines. Very important. Never ever share the identifiable information of the client like name, address, date of birth, location, their age, their school. Personal information should never be shared with ChatGPT. You can write 28-year-old client going with these symptoms, but do not share the personal information, phone numbers, email IDs, address, location, right? Um, there is a HIPAA Act with all of us. So there are certain acts. So this violates that act. So first and very important rule is this: do not share the identifiable client information. Second important rule is AI can make mistakes because it is artificial, not human. So always verify the AI generated information. DSM, ICD, what are the guidelines? Always identify that, and also try to avoid using it for diagnosis, but you can always have a cross check, making use of your tools like book, ICD-10 book, and DSM-5 and latest publications, right? Next rule is AI cannot replace human thinking, logical thinking, critical thinking. So use AI efficiently to assist, not to replace you. Clients can do that, but definitely they're going to come back to you as a human to get a human touch, to get a one-on-one bond and connection. So you not replace yourself. It is always critical thinking which is done by. You should not replace it, use it as an assistant, right? Clinical reasoning is our responsibility. So do not 100% trust and replace everything. And lastly, and very important, never quote saying that ChatGPT said this. You know, this will be this. It always, we should always maintain the professional judgment. Being a new therapist, sometimes we are going through ChatGPT, but we should never mention it. So never quote that ChatGPT said that. Don't integrate this into your own expertise. Yeah. Now coming to the practical cases, practical usage. Try prompts like these. I'm sharing the prompts here in my screen. Try prompts like these. The first practical case can be practical use, can be case preparation, session preparation, handouts, psychological, psychoeducation handouts. So in my community, students are using ChatGPT like pro. They're creating prompts, they're creating handouts, they're creating worksheets and homework. So if you also want to be a part of my community, join. This link will be shared in the description. You can join this VIP group and be there, and you can attend my free webinar and free classes to be a part of the community. So what other prompts you can use is create psychoeducation handout for a 18-year-old client of say facing panic attacks, or you can use please suggest behavioral activation homework for my client of 23-year-old dealing with low self-esteem. So these are certain prompts you can use for your session preparation. Second practical use is therapeutic worksheets. Yes, you heard me right. Therapeutic worksheets, CBT worksheets, anger worksheets. depending upon case to case, graded exposure worksheets, emotional logs, gratitude journal, basket of all the things, right? So that is the second practical use. Third practical use is very important. Everyone is using these days. I'm also using it for marketing, branding, and content creation, Instagram scripts, YouTube scripts, ad placements, reels, blog articles, LinkedIn articles, webinar education, presentation, everything for the marketing content from A to Z. You don't need to hire your marketer. You can use ChatGPT as your marketing content strategy to build your own private practicing if you are someone who's starting or thinking to build it, right? I'm also doing sessions with my community people to how to build their own content using ChatGPT. It saves hours and weeks of time, believe me, right? So, where it should not be used in suicide risk assessment, in diagnosing disorders, in legal documentation, crisis intervention, with children protection decisions. In certain cases, please try not to use AI. Let's handle it with human brain, human mind, human heart. That is important, right? Future of AI in mental health and in real life is going to be at a boom in next 3 to 5 years. So let us try to be friends with AI. Let us use it efficiently, effectively, ethically by having a right hands-on clinical training, documentation, understand how to use it. Right, your main role is to have an empathy, ethics, and human connection. Let AI do the most of your assisted work. So yes, use AI for productivity, maintain client confidentiality, verify everything. Do not share everything about your client to ChatGPT and keep the clinical judgment, human bond, human intelligence on, right? So, till then, if you really find this helpful, comment AI with ethics and subscribe to Therapy Trailblazer Academy. And if you want to be a part of my community, just feel free to join this group.